the views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
Good evening mga quarantine! Sa ngalan ni Attorney Ray Chris Panugaling, ako si Chara Villanueva.
Huwag ako si Dr. Helen Madamba.
Welcome to Debunking Myths.
Good evening mga ka-quarantine. Good evening, Chara.
Good evening, Doc Helen. Good evening mga quarantine.
Yeah, so extension of our celebration of the World AIDS Day tonight na tayo debunking myths on HIV/AIDS.
Yes.
And we would like to introduce to you our two special guests for today's Soto Live.
That's right, Doc Helen. Now let's start with our first speaker for tonight. So we have, she's a diplomate in internal medicine. She graduated from Cebu Doctors College of Medicine. She had her residency training in Cebu Doctors University Hospital, a medical officer 4 in the Department of Internal Medicine, and of course, a hacked physician in Kaambag Clinic here in VSMMC. Ladies and gentlemen, mga quarantine, let's all welcome Dr. Marcelina April L. Gonzaga.
Of course. Yeah, so we also have, ito, busy-busy to, pero at least he made time for us, especially for us, because we want to make sure that people have good basic HIV knowledge to reduce stigma and discrimination. So our second special guest finished his College of Medicine at the UP College of Medicine with residency and fellowship training in internal medicine and infectious diseases at the UP-PGH. So, ang gusto niyang introduction sa kanya, basta IDS lang daw siya.
Okay.
No, yan, IDS. But he's so much more than that. So, we are very lucky to have him in Cebu during the time of COVID. But we're also lucky to have him as an infectious disease specialist managing HIV patients. So mga ka-quarantine, please help me welcome Dr. Brian Albert. And thank you very much.
Sure.
So mga ka-quarantine, if you'd like, you can like, share the VSMMC Facebook page at official VSMMC and watch party aron mas daghan ang mga people living with HIV who will benefit because we will be talking about the different myths on HIV.
Yes, that's right, Doc Helen. And of course, mga quarantine, if you have high-definition photos or videos, you can send them in at vsmmc_osm@yahoo.com or osm@vsmmc.doh.gov.ph.
Yan. So we are all on Twitter at official VSMMC, Facebook at official VSMMC, and also on YouTube at Vicente Soto Memorial Medical Center. So every day we still continue with the commitment of delivering public health information dissemination. And tonight, we will be talking about one of our topics close to our hearts, no? HIV and AIDS. So, kamusta naman kayo, sir?
Okay na. Traffic na kayo nun. Traffic na kayo.
Wala, nag-yun ang COVID. So, balik na po ang traffic.
Yes.
Especially Christmas time na pala.
Mao yun.
Okay, sige. So, can we have the first debunking myths? We would like to acknowledge, no, our live audiences.
Yes.
So, thank you for being with us tonight. So, Boy Jamel, BJ, good
evening, Sir
Yan,
BJ.
hello, good evening. And I would also wave hi to Jessa Alemania. Hello there, Jessa. Kamusta? Ang nanay ko po nanonood. Hello, Mami.
Hello, Mami.
Very good. Support team.
Yan, sige. So, let's, without further ado, adto na ta sa atong first nga myth to be debunked.
Yan.
Yan, so ang first myth nato, no? HIV and AIDS are one and the same. Pareho ba ang HIV ug ang AIDS?
Okay, Doc April?
Okay. HIV, this is the virus, that infects the individual. So, and AIDS is the condition, when the patient is not managed, with the HIV, with the virus, we have antiretroviral medications. But if the patient does not take his medications, eventually the patient will develop AIDS. So that's the difference. HIV is a virus, AIDS is the condition, chronic condition.
So, tanan ba ma'am nga na ay HIV, na ay AIDS?
Not necessarily. As long as the patient is managed, the patient is very compliant with his medications, with the follow-up. So we will try to delay, the progression of the virus, to develop into AIDS.
Right.
Conversely, ma'am, tanan ba nga na ay AIDS, na ay HIV?
Ang tanan nga na AIDS na HIV. Yes, it is an immunodeficiency syndrome. Okay, so muna siya. So that's the endpoint, of the virus, HIV. So the endpoint of HIV, if the patient is not taking any medications under antiretroviral medications, maabot na siya AIDS, eventually death.
Okay. So yan mga ka-quarantine, different, lahi gyud ang HIV ug AIDS. Dili tanan nga na ay HIV mahimo og AIDS, pero tanan nga na ay AIDS na ay HIV. Kay necessary cause man ang
Yes.
HIV. So, Doc Brian, do you have anything to add?
Oo, mao gina, no? So mura na nag-uyab mo, na dili na pasabot na nagmagminyo na mo pagkahuman, no?
Good.
So bottom line ka ng sakto na gino ni Doc April, no, na ang HIV matakdan ka na kay virus, but that doesn't mean kung imo na gyud siya gitagat og tarong na pwede gid siya dili mo proceed og AIDS. Nagdi mga pasyente di ba Doc April na kung aon nimo mas healthy pa nato,
Yes.
di ba? Kinaon tinuod yun mas akong paglawas, athletic kaayo para buyag kay nanuman may man kay mo antiman ng atong staff sa kaambag nani kayo. Sige follow up. Kay pasabot ana basta mo tarong na gyud kaon at tambal ingon og tarong dili magsigarilyo, mag-exercise para buyag daghatag pasyente na living healthy lives.
Okay, yan.
So
Yan
mo na
muna.
nindot kayo.
Okay, sige.
Yes.
But can we have our second myth? Yan, Shara.
Okay, myth number 2. HIV can spread as a result of touching someone who has it. Unsa ni katinuod? Doc Brian, Doc?
Dili gyud, no? Kay importante kaning mga infectious diseases makabalugid ta kung giunsa na sila pag-transmit. Ang COVID pa pwede, no?
Yes.
Dili tanang virus pareho mo na gina importante na natong mahibaw-an. So kani pag kung atugin istudyohan ang mga virus kailangan makibaw ta giunsa siya pag-spread. So ang COVID mo na matakdan og gunit-gunit kay gunit kasi mong mata kana sakto na. For HIV dili in town, no?
Okay.
Oo, gikan in town na ang mga transmit nato ang COVID sa unsa man sa living tissue sa dugo, no? Kung sa dugo niya sa sex kana, no? Niya kung nag-transplant mo og organs na wala na screen, pwede ta matakdan. So nindot kina na atong slide, no? Sa nang ato na tan-aw din, sa nang breathing in the same air. Dili yun ang COVID. Yes. Pero kani miski magkaraoke pa ka, magparty pa ka sa mga tao. Ay, sa kay COVID pa man. Pero di na makatakot, ha? Kana using the same toilet, dili sad, no? Oo. Kanang hugs, kisses, or handshake, dili. Of course, COVID, kini tanang COVID, matakdan yung kanatanan. Pero HIV dili in town, oy, no? O, unless kanang inyong pag-kiss kay naghakim samad sa inyong mga ba kana pwede siguro, no, kay dugo man ang ato ang ikon, wala dili man sharing food or utensils dili sad, no, anong drinking from the same, but again all of this sa COVID kayo na kung itaw oy look di sa nato i-discriminate ang atong mga patients na HIV kay dili na sila makatakot sa inana, ha. Okay, lagi ko yung mga amigo na na-avoid HIV and katong wala pa'y pandemic, magkaraoke ni, katong wala pa'y kuwan ba? Wala pa'y pandemic, wala pa'y problema, no? Oo.
Okay, sige, very good. So, we have to remember nga, ang HIV makatakod lang kung na-infected blood, vaginal fluid, semen, or breast milk. Dili sa mga pamaagi nga atong gihisgutan karon.
Sakto na.
Pero Doc, di ba mag-differ man gihapon, like for example, katong mong di-mention ganina nga if naisamad, pero mag-differ gihapon sa amount.
Sa amount sad.
Amount sad. Kaya nakadumdum ko sa topic ni Doc Lake, ni Doc Cham last week.
Very good. Sakto yun kayo
Hindi po sa amount.
Buti pa si Chera, may natutunan siya.
Very good. Check.
Kasi natanong ko yan, if may open wound, tas na-splash, infected ba agad ng HIV? So, depende din sa amount.
Unless blood compact mo pa, niradya mo ba ako?
Grabe ng pag-ibigyan
Pwede na.
Okay, sige. So, we'll move on to the next myth.
Yes.
Ayan. So, you can tell if someone is HIV. I suppose just by looking, no? You can tell if somebody has HIV.
So,
Who would like to answer?
Okay, go ahead.
as what Dr. Brian said earlier, no, natay mga patients dun na conjugate sila, they're living their lives dun, no, they are working, they are pursuing their passions, no. You can't tell dun na they are HIV positive, no, unless siguro katulad yung what I've mentioned before, na dili mo take some medications, no, there are AIDS-defining conditions, diha siguro, pero dito ka kaingon na mao dun na siya, no. So, to answer that, no, you can never really tell na someone has HIV unless, no, nga mapatest din siya.
Sakto yun, in this day and age, bawal maging judgmental.
Bawal judgmental.
Ayan, di ba? Bawal judgmental.
Oo, kaya pinigig ka kay to apply that concept. So, usahay ang problema na ako sa kaning pasyente na muanig bitaw sa akong clinic na uy ka nang nag-sex man ni na ko nag-condom kay mura man siya walay HIV kay limpyo man kay siya tanaw ko na. Usa di mo pasabot sa HIV hugaw? Dili man ka usay mo mata ba?
Judgment.
Makakita kag genetic.
Cyclops.
Dili special power mutant na imong mata makadetect. Dili, no? So, pasabot sa ana, so when you engage in the sexual relationship, di sa ka makaingon na, uy, limpyo man ko ka nang, okay na ni, uy, way kondom, kay limpyo man ko. Di sa ka makaingon, di ka makaingon. Kaya, gingon nitong April, most of our patients in our kaambag are, you can never tell. Kay, ano man, they're taking their meds, maayo man, especially in the early onset of HIV, dili man na mo manifest akan ng pagka mga wagi fascist na gitawag, no?
Okay. So I guess the best way really is to get yourself tested and to make sure that you don't engage in risky behaviors.
Yes.
So kung naatay message sa tanan aron malikayan ang HIV, so get yourself tested and know your status and avoid risky behaviors because you cannot tell kung ang sa katao na ay HIV just by looking.
Yes.
Yeah, next.
Let's go to our myth number 4. HIV kanibog at ni is a death sentence. Sa ni katinuod mga doc?
Yeah.
Dili yun, no? Kanang bitaw na ay mo adto na kong pasyente sa clinic niya moingon siya naladok na ako'y HIV niya, hilak na siya niya. Moingon siya, dok, nanong kalma man kay ka? Iko na, kaya di ba ka mamatay? Di ba? Mas mamatay pa kung magsigig kag sigarilyo. Mas dali pa imong lifespan, no? Pero di yun kay ang kanon na alagi mga study na unsa man ang life expectancy sa pasyente na naay HIV nga sa pasyente sa mga tao na wala HIV. Ang answer pareho ra. As long as mo inom tag tambal, mo follow up ka sa doktor nimo, ang mga laboratorio buhatan na sa kaambag nindot makayato ang system kay naamatay mga muantiman gyud na naka-coordinate, no? I-remind pag ka, i-text pag ka. Oh, so kanang di giwa na gyud excuse ba kay ang tambal na to libre na gud na siya. So you take your meds. Ako ang pinaka-oldest na pasyente kay 78 years old. Wow! 78 years old, happy, living his life. Pagkaroon, sige man na siyang time sa una karnuwa na kay COVID man. Pero he's fine, he is fine. Nanuman, naningkamot intaon, naningkamot na mong inom ng tambal, no? So kanong gani ang mga topic sa convention sa HIV kay the aging HIV patient. Ayan, age ka na, tiguan na.
Mga chronic diseases.
Correct, mga amo. So, pasabot ana, as long as imong life expectancy pareho ra sa pasyente na walay HIV.
Dr. Ryan, ako question no, rooting from this. Lisod ba mo tumaro og tambal sa HIV?
Dili gyud. Dili gyud. Okay? In town, oy atong tambal, unsa niya na do atong tambal?
Once at one day,
One
one
pill,
pill na,
once a day.
once a day. And then right now, natay new nga ko medication na kaya mas lesser na siya side effects than the older.
That's
Okay.
also one pill once a
One
day.
pill once a
Okay,
day.
also dili
Usama ko
lisod. Dili lisod mo take og tambal sa HIV. So, adherence tingali no
Yeah,
kinahanglan kung na kay HIV, tumarla og tambal one pill once a day.
Kung naa kay time mo wear sa imuhang underwear, naa kay time na mo inom si mo tambal. Charo oy. 5 seconds na inom, human.
So on the part of the HIV patient, responsibilidad sa nimo, no, ang pag-atiman sa imong kagalingon, dili pud kay isalig na lang pud nimo sa sige, sige bitaw sila follow up.
Yeah.
Di kay follow up, di pud ko.
Correct.
Kay matid pa ni Doc Helen na ay forever sa HIV, pero HIV doesn't stop you.
Okay. So life goes on despite HIV. Na-pick up na lahat ni Chera yung lines.
May talaga.
And it's free, good siya, free. So, yeah, there's no reason.
Wa na gyud reason dok, no? No. Amo pag ani i-deliver usahay na do, kabi na man ko
Going the extra mile.
Aw sige makita ta sa Robinson amo ihatag nimo sa parking lot mo ana maggaita.
Hindi mo na mong angkas.
Miski gabi miski weekend ko kinahanglan gid maningkamot gyud mi na makita ta, no? Oh. Ito do? No?
Ang no? Dedication ng ating mga case
Yes.
managers and the Barbies no, of the house.
They should
Correct.
So saludo kami sa lahat ng staff ng ang ating mga HIV/AIDS treatment hubs.
Yes.
So despite COVID, no?
Yes.
Despite COVID, nagpadayon ang pag-atiman sa mga staff sa HIV/AIDS treatment hubs and primary care centers sa paghatod sa mga tambal sa mga PLHIVs. Sa pila na ba ka treatment hubs na sa atong area sa Central Visayas karon? Pila na, Chera? Basin
Kutigo.
kung naay gustong magpa-test ug naay
Yes.
mga PLHIV diha na bag-o nga na diagnose, daghan ta og mga treatment hubs ug mga primary care centers sa Cebu and in Central Visayas. So no reason na dili mo mutuma sa inyong tambal.
Yes, so if you want to get tested or if you want to have your medical consultation, so these are the DOH designated HIV treatment hubs and primary HIV care facilities diri sa Region 7, Central Visayas. So, kung pangalan, we have Cebu Provincial Hospital, Balamban, Cebu Provincial Hospital, Carpar, Chongwa Hospital, Mandaue, Eversley Child Sanitarium and General Hospital, naasad ta sa Governor Celestino Galiares Memorial Hospital, na siya sa Tagbilaran City, naasad ta sa sa Bohol. Naasad ta sa Negros Oriental Provincial Hospital, Talisay District Hospital, Vicente Soto Memorial Medical Center, nasa ta sa Visayas Community Medical Center. And then, meron pa ba? Sa Cebu Social Hygiene Clinic, Danao City Social Hygiene Clinic, Mandaue City Social Hygiene Clinic, and Talisay City SHC. Yan.
Okay, so daghan no, ang kalahian lang sa atong
Yes.
treatment hub o atong primary HIV care center. Ang HIV care center is OPD basis, no? So nakahatag sila og mga tambal, naka-consultation, pero kung kinahanglan ka ma-admit, diha ka sa HIV treatment hub. Admit.
Yes, like here in Soto.
Yan, here in Soto. I think Soto is the oldest, no, and the biggest hub
Yes.
outside of Manila. Okay, sige, padayon ta sa atong myths. Yan, so the fifth myth, no? HIV spreads through mosquito bites. So kung ako na ay HIV, gipaak sa, ano ba yung mosquito?
Lamok.
Sa lamok. Kunya, gipaak pud ka sa same lamok. Pwede ka bang magka-HIV?
No, no. Unlike dengue, no, nga vector jud ang mosquito for dengue fever, but for HIV there are no ano there are studies, no, na but wala nila na pa nga na-adjust kanang transmission through mosquito bites, no. They don't live, no, sa mosquitoes also. So mo na siya. So no, HIV doesn't spread through mosquito bites.
Okay.
These are backed up by studies jud, no.
Pero dengue, pwede ma-transmit, ha?
Yeah, dengue.
Oo, ma-dengue.
Dengue kay pwede.
So dengue, okay. So ang HIV, medyo lisod siya na makatakod, no, og HIV. So ang mosquito bites do not transmit HIV. So correct siya dyan.
Correct.
Okay, sige. Can we have our next?
Our next myth, ang atong ikaunom nga myth karong gabi una about sa HIV, you can't get HIV through oral sex.
Yan.
So, nakatinuod.
Sige.
Oo. Kung na ron, sakto po na, may na siya na pangutana, no? Kay it's a valid activity. Okay? Pero, the answer ana, yes and no. No?
Yes and no.
Pero most likely no yapon. Kay kuan man kanang as I've mentioned, ato ang contact is blood, kaya kanang naay-opening si imuhang lawas. Pero for example, imong baba kay daghang samad, no? Unya, let's say mo ejaculate sa imuhang baba or kana pwede na ay posibilidad. But the chance is small, but there is a possibility, no?
So ikaw na receiver, kung naay samad ang imong baba and you
Yes.
the ejaculate is in your mouth.
Yes, kana.
The
Oo.
ejaculate of an HIV infected person
Oo.
is in your mouth.
Nga, naana magita diri, no? So, for example, if mag-ejaculate sa imong naong, makasulod sa imong mata, possibility na siya, no? Kaya mucosa mangyapon na, masundan mo na ng dapitan, no? So, but generally, oral sex, dili ra, no? Kung wala na tayong mga lesion sa bangka. But I do have to tell you this, no? Kanang, when you are performing that of strangers, it's best still to have a condom. Kaya dili naman sa tawag nimo kanang HIV ang ma-transfer. Ana, napay pasyente na naay herpes ang penis, no? Ulcer nga gi oral sex yung partner na herpes butang baba. Naapo pay pasyente, yes, naay syphilis, naagi chay cancer sa iyang kuan, no? Unya naa sa samad, nagka-kuan siya, nagka-syphilis gid sad siya, naa siya guma sa iyang kuan. So there are certain diseases magod that can be transmitted. Also bacteria can be gonorrhea if ever mabutang, pero generally gamay ra gid siya na risk, but the risk is there.
So you can still have sexually transmitted infections through oral sex.
Yeah.
But maybe when you're talking about HIV, maybe we can compare yung anal sex versus vaginal sex versus oral sex. So our oral sex would probably have the lowest risk. But the risk is still possible.
Yes. Nagya po yung risk.
Dili zero.
Yes.
Sige. Ma'am April,
Nakaian?
Okay na.
Okay, so number 6 myth, no? 6 myth. You can't, people with HIV should not have sex.
Okay, so mo na siya frequent sa jud nga question no in the clinic no nga doc ano tami doc sorry excuse me. So actually you can no as long as you practice no the barrier katong mag-condom jud no and then mo jud na siya pinaka important jud no and also you have to also tell your partner no nga mo na no you should be honest no so mo na siya you can still have sex so mo na siya.
I think same lang is sa katong imuhang pamutana sa ko alas dito Doc. If ang babay nga na HIV, pwede ba siya magkapamilya? Pwede ba siya magkaanak?
Okay. And then kinahanglan na mag-sex para mabuntis.
Di man then ni ana ka nga women kanang naay right to build their own family, no? So as long as naay support system, kabaw ang partner, honest ka, then go. Again, HIV doesn't stop you from building your own family. So, mo jud akong napulot ko
Correct.
last week.
Yeah. Kanipong sex, no? Let's talk about it more, no? Sakto, first, you need to tell your partner that you have HIV. I think it's fair, no?
Yes.
Because love is about opening yourself up and trust to the
It's a
other
big
person,
word.
no? So, important na makabalo. Okay, so mag-discuss mo, ana. Okay, so kung gusto yun, because intimacy is part of it, no? I have had patients, no, na tao na mong zero discordant partners na usa positive usa negative.
Big word, zero discordant.
So ang gisulti na mo ato niya, so condom sila, condom. Pero nagsabot sila nga they will have sex kung undetectable na ang iyang HIV.
Yan.
Okay,
So,
once
ano ibig sabihin, Doc Brian,
Yes.
ang undetectable.
so once you start your treatment, there will come a time that your viral load, ang virus, ang kagaw sa imong dugo, kay low na yung kaayo, hindi na siya ma-detect, or it doesn't mean na zero. Okay, once you have HIV, it's already in your system ang yun, no? Pero, kani undetectable, pasabot ana, it's so low na ang tuang machine, dili na siya ma-detect, mo na pasabot. Unya, ang transmission po niya when you have sex is also minimal, very minimal, no? So, ang katong mga amigo, nagibuhat nila, nag-sex sila, usap with condom gyapon, but they did it na katong undetectable na ang iyang partner. Ha? Now, just in case, no, anay magyud ni ka ng the heat of the moment, ay, lami na yung kayo, no, na di na tamang condom, niya, ala, nakalusot, nakakuan yun, wag yun, wag na yung kayo, wag na ginabuhat, kinahita mo na atay post-exposure prophylaxis.
Yes.
No? That's, I think we need to talk more about it. I think as of the moment, it's not part of the government program, but you can approach physicians or infectious disease specialists that if naay mahitabo na in ana, they can prescribe you with post-exposure prophylaxis. So, kasi pasabot ana, if you will take the medicines within 24 to 36 hours, the chances of you getting HIV is very small, close to zero. So, kung mahitabo mga inanang mga emergency na yun na kuan, please do not be shy and approach para maano na to, kuan ba, ma-antiman. Okay?
Yes. I also like to add, as what Dr. Brian said, no, katong post-exposure prophylaxis, we have patients also, no, na na-abuse sila.
Yes.
They come to the Kaambag clinic, and then we cater to them. We manage them also. We give them post-exposure prophylaxis, so you can always go to Kaambag clinic also.
Sakto kina Dok ha, kay sa una na ko'y pasyente na na-rape.
Oo, kana, Dok.
Unfortunately, na-rape sa iyang uncle. Unya kanang ni abot lang na parinti niya, hawa na rape siya. Niya usay mo ulaw-ulaw mo go dili man tapos to niya. Wa siya kay balo sa HIV status sa iyo parinti. You can come and we will take care of you.
Yes.
No, we will give you meds, especially for these conditions of rape and all of this abuse, ha? Oo.
Oh, so there is a bisection, there is a cross-section between gender violence and HIV/AIDS. In addition to HIV/AIDS, all other sexually transmitted infections are also treated at the Pink Center of BSMMC. So there's no shame in seeking for help. It's important to be able to admit or accept what happened and seek help that you need.
And if I may, ayaw kaulaw sa inyong mga sexual practices. Believe you me, we have heard it all.
We have heard it all.
Ha? We have heard it all.
Hindi naman siya.
If I were to produce a pornographic series, it will be so fantabulous. It will deserve amazing awards, no? But ayaw mong kaulaw kay we have heard it all, and we in our clinic recognize your rights, and we support you, and we are there to take care of you, and we are not judges. Dili mi attorney, no? We are lawyer, we are doctors. Muantiman mi ninyo. We are not here to judge you, we are here to take care of you, ha? Walay ulaw-ulaw.
Especially our case managers, no, they're very approachable.
Yeah, so mga ka-quarantine, you heard it from the mouth of our healthcare workers, our doctors at the HIV treatment hub, our Kaambag clinic. Kaambag kasi we are partners, no?
Yes.
That's the basis for the name. We are partners. So we will not dictate on you. You will not depend on us, but we will help each other take care of your health. Also at this point, we would like to acknowledge our live viewers, no, na si Pierre Habagat. Good evening. Helen Valenzuela, Madam Enchera Villanueva. Also to Doc April. Welcome to Soto Live. And the comebacking Doc Brian.
Evening, Sir Pierre.
So naapod si Noich Satid. Good evening, Doc. He's watching here in Kuwait. So, abot tayo ng Kuwait. Ma'am Isabella Sufra and Monin Dumas Sarabosi is also watching. Hi, Monin!
Yes, we also have Clint Palo is also watching. Hello.
And also Mary Alfanta. Good evening, everyone. So, thank you very much for always tuning in. So, daghan tag matunan. Matutunan.
Makapunan.
Yeah, makatunan. My goodness. Okay, so, we can better take care of our own health. So, while we're talking about HIV, when somebody with HIV approaches you and you still abandon them, it's not their problem anymore because it is your narrow-mindedness that is the problem because so far we have been giving you HIV knowledge. Now, attitude and practices is up to you. So, we hope that with all of the information that we have been giving you on HIV and AIDS, dili ta matakot. Hindi matakot.
Makuya, mahadlok.
Dili ta mahadlok sa mga people living with HIV AIDS. They're just like you and me. It's just a disease that can be managed and they can continue to live normal, productive lives.
Let's stop that stigma.
Yes.
No nga, HIV nga pasit, di na ka pwede makadukol, murag hugaw na gyud kaayo siya. O, diba?
Okay. So, naamoy mga gusto pang i-express sa ato mga ka-quarantine?
Sure, no? I think ang usang intersection sa quarantine and COVID and HIV na agyud. Because now that wala na ta sa ECQ o GCQ, nidaghan bitaw na konsulta na positive. No? I think it's because of the stress in all of the pandemic that some of our brothers and sisters engage in risky behaviors. No? So I think it's important, no, na napugod sa clinic ka na rape in their household because of this quarantine and all those things, and this is real. This problem is real. So I think it's very important that we are able to recognize this. Tao lang tayo, no?
Yes.
And minsan Tagalog nung takbo ng contagious. Ang Tagalog ng contagious. So
Okay.
tao lang tayo, no? In the moments of weakness, it's all right. No, we are here to guide you. We are here to take care of you. So, but all we ask is please consult us, visit us, and take our meds. Libre bitaw, no?
Correct, Ma'am April.
Also, it's very important, no, to know your status. No, that's what we are working on. No, you have to know our status if you believe you're engaging in risky behavior. So it's good na you have to know your status so that you can also take care of your partner also, no, so that kayo ma-aware po sila, no. So when you know your status, you can come to the comeback clinic, and then we can provide help for you, emotional tanan help sa inyo, ha. So don't be scared to come and consult us.
And do we still give condoms?
Yes.
Yeah, we have free condoms in the clinic also. Siguro the next, naman sana next pandemic, but that's a footnote, no? That all of these condoms and preventive measures should be part of the package of ayuda perhaps in the future,
Yes.
no? Or make it more accessible, right? Even during the pandemic, no?
Condoms
Yeah.
and lubricants.
Yeah, we have it, no?
We have
Okay, so at this point, we will look at the COVID statistics in our hospital.
Ang VSMMC Subnational Laboratory nitala sa mga musunod karong adlaw Lunes petsa 7 sa Disyembre 2020. 285 ka samples ang natest karong adlaw ug kini tanan gikan sa Central Visayas. Sa kinatibuk-an, 120,468 na ka-samples ang natest sukad sa pagsugod sa atong subnational laboratory. Sa 285, usa niini ang positive ug 616 ang negative. Suma total, aduna nakitay 11,229 ka positive samples ug 109,170 ka negative samples. 51 ka samples ang kasamtangang gadagan karon sa atong laboratorio. Paidumdum lang sa tanan nga ang mga resulta base lang sa mga samples nga gitest. Ang DOH Regional Centers for Health Development ang mupugawas og detalyadong impormasyon mahitungod sa mga positibo o negatibong kaso. Daghang salamat.
Aniya na mga pinakaulahing balita kabahin sa COVID-19 dinhi sa atong tambalanan karong adlawng Lunes, petsa 7 sa Disyembre tuig 2020. Ang sotong mirehistro na sa mga musunod. Sa kinatibuk-an, 1,407 na ang kumpirmadong kaso diri sa atong tambalanan. 586 niini ang nakarecover na. 427 na ang nakudloan o kinabuhi nga naggikan sa lain-lain nga lugar. Sa kasamtangan, aduna pay 7 ang padayong giatiman diri sa atong tambalanan ug 386 usab ang na-transfer sa atong mga isolation centers. As far as our bed utilization is concerned, the total regular bed capacity of VSMMC is 865 beds, and currently we have 726 patients admitted. This gives us utilization rate of 83.9%. Our expanded COVID-19 bed capacity is 185 beds, and currently we have 7 patients admitted. This is a 3.8% bed utilization rate. Our ICU bed capacity is 55 beds, and currently we have 14 patients admitted. The dedicated ICU for COVID-19 is 24 beds, and currently we have 3 patients admitted. This gives us a utilization rate of 12.5%. Daghang salamat. Okay, so thank you very much. Kana ang atong updated na COVID-19 census sa atong tambalanan. So mga ka-quarantine, please do not forget na naapagyud ang COVID sa ato karon. So we should continue the minimum health standards of wearing face masks, face shields whenever we go out, ug sanitize our hands, hand hygiene, and maintaining physical distance as much as possible.
Yes.
So, we would like to announce that nagpadayon ang atong drive-thru, walk-thru, RT-PCR COVID-19 testing diri sa atong tambalanan. You can just register online to set up your scheduled appointment and then drive-thru or walk-thru on the day of your schedule. And our commitment to you is that you will receive your results within 4 days. 4 days through email. Yan. So, mga ka-quarantine, pwede na magpa-test. Free testing for COVID-19. Free pag-yun ang pagpa-test sa HIV. Oh, yan. And then, because of all of this, we would like to thank our Medical Center Chief, our Incident Commander, and the producer of Soto Live, Dr. Gerardo M. Aquino Jr. Yan, thank you very much, sir. And also to DOH Regional Director Dr. Jaime Bernadas, and special mention ako sa HIV Program Coordinators Dr. Van Philip Baton and Sir Mike Patrick Iganya and the rest of the team sa DOH handling HIV, with all of the staff of the HIV treatment hubs and primary HIV care centers in Cebu and in Central Visayas.
Yay! Good news yun. Good news.
Yes. We would also like to thank our partners, donors, sponsors, and to all of you, of course, our mga ka-quarantine sa inyong padayon nga suporta o pagtanaw diri sa among mga programa diri sa Soto, no, Doc Helen?
Yes, and we'd like to congratulate also Dr. Ligaray and her team sa Vicente Soto Subnational Laboratory sa pagpadayon nila sa atong mga programa o sa RT-PCR testing. And mag-say hi ako, Attorney Ray Chris Panugaling. I miss you so much.
And of course, di na to kalimtan ang atong mga COVID warriors, atong mga survivors pod, no? Nga kalayo na nakipaglambisog ba na yung term? sa kani nga pandemic.
Oh, sige, so and before we end, no, Doc Brian, any comment or any advice kay hapit naman ang Christmas. Unsa na to pagprepara aron dili mag second wave of COVID.
Correct. Sakto gina. No, muna ang ako ang gikadlukan. No? Gabi-gabiin na ko si pangadji na dita mag second wave. Kinanuman, based on the evidence from Europe and other countries, the second wave is worse than the first wave. And I still remember the first wave of Cebu, and it was a living nightmare. No, I lost my dad during that time of the first wave. There was a time na walo nagtungadungan og patay dead on arrival kay it was really terrible, no? And then I could not imagine a situation na mas worse pa atong sa una. Yeah, atong ni sabton ang COVID, as I mentioned before countless times, mo agad na gina siya sa human behavior, sa kanang magtapok-tapok, ginahan kina siya mo spread, no? So kaning Pasko, as we always say, let us put Christ in Christmas, let us put Christ in Christians, no? And for God so loved the world that He gave His only Son, so we have to share that love to others. How to do that? We need to take care of others. So kung pwede dili na mag-party in town, ayaw lang, ha? For this Christmas, let us pray. Kaya tinut-anay ang kaning Pasko, ampo magini kaning mga party-party, mga churba-churba na lang.
Bonus na
no?
lang, bonus.
Ampo magina kay tinut-anay. Yeah, it's really prayer and welcoming Jesus in our hearts. That's the essence of Christmas, and we have to be reminded of that. Pero kung di cute ka, antos ka naman na, uy, Dok, Pasko,
Napay ko exchanging gift.
So, number one tip, kung mag-gathering yun, si inyuha lang sa balay, kamukha mo lang sa pamilya. Anyways, kung ano bitaw mo, kamo na magbitaw nag-uban sa balay, kamo lang sa balay. Kaya kung mahitabo ani, kung mag-party mo sa balay o mag-dinner, mas maayo sa gawas, sa parking lot, no? Kung kanang karsada, dinadaan mo. Kay mas maayo ng open air para digin mo magtinagdanay. Dili na mo mag-amin-amin sa inyong lulot lula, ha? Kay kanang amin-amin o takibaw, makatakon. Kaya kanang ninong ug ninang, i-Gcash na lang. Agree?
Mas practical,
Agree?
mas practical.
Oh, kanang angpaw sa init signet, ala. Ang sunod sa kong angpaw kay mas. Akin nila kwarta, dili mas ang sunod. Ha? So, unya na lang na sininong ninang, Gcash na lang, zoom na lang na. Dili mo mag-house hopping sa Pasko, ha? Dili yun. Kaya you will be a vehicle for COVID. Can you imagine that kung ikaw ang naging vehicle sa COVID, yung mamatay to imuhang gispreadan, you literally killed another person. Sakit man storyaon, no? Sakit na may yung kagsa nimo, pero tinun anay sa gina nimo, no? Kung naay mamatay tungod wa ka careful, forgive me for saying imo nang sala. So please, let's be good Christians and not let us spread love and not death. Unya, sa pa may mga tips na to ani, kung sa balay mukaon dili mag-share na kinamot, ha?
Bawal ang
budol fight, no. Kung naamoy pagkaon, usa lang ang mo serve. Kanya, ang style ako sa balay, ang pagkaon sa kong inahan, kitiguang mga inahan, na kung mga auntie na tiguang, lahi ilang mga lami, ilang utensils, lahi, ako ang maguwang, lahi sad. Nasa lamisan na mo, ang style, mga tiguang na adiri, kami mga batan on diri, lagyo, no? Kay, you want to share, but you can do it safely. Yes. Ako sad karon kung magpasko na, di na ko sigla ko lakaw, para buyo, wala naman ko'y pasyente na COVID, extra careful ko, kay mag-meet mo ko sa kong inahan pagpasko, pero social distancing, yapon me, but I will be meeting her. No, kawag ko uli-uli since March, no? So importante na. So from this day onwards, be more extra careful of your actions na dili ka matakdan sa COVID, no? You should not be bringing it into your homes, ha? So mora na ato ang tip niya kung let's say na agi mo'y bisita, schedule na sad sila, murag mo na clinic na schedule.
Appointment.
Kaya ka antos, maapil ko, oh sige, schedule, ikaw ha, karong adlaw, mura ni ha. Imong man sprayan imong balay pag human, inyo po man ang limpyuhan, ha? Nga, kung mukhaon mo, ako bitaw, mag-restaurant, magdala bitaw po ako ang baso o kutsara, gibinuang. Kaya kuha din na nila gitara kung limpyo.
Ayo.
Ay, sure you ka na, ilagay ng limpyo ko kayo na. Magdahagi ko yung kutsara, tinidor, baso, bahala mo eh. Magdapo, kung pwede magdapo mo ko ang plato, magdapo ang plato. Kay, be careful. If you have elderly now, lami kayo, gawas-gawas, do not place them in enclosed environments. Sa mga tiguang, ha? Ako ang inahan, kung mukhaon may restaurant, naanda ko'y listahan sa kanang mga restaurant na alfresco sa gawas. Di yung ko musubot na nasa suna mong inahan kay what if naaming usab mo ubo din na i-COVID. Ay, wa na.
Mabungkag.
Wa na. It will be a very lonely Christmas, no? Don't spread death, ha? Spread love, okay?
And Neil, how many days do we have left before Christmas?
18 days.
18 days to go. So let's make Christmas a more meaningful celebration.
Pero ana sila dok, madelay ko kuno og deliver si Santa Claus sa regalo kay abot ko na niya i-quarantine pa man. Madelay lang sa
Mag-drive-thru ang reindeer din na sa Soto kaya hindi pa.
magpatesa sila. Gcash na rin.
Gcash na lang.
Okay, so I hope daghan mo nakatunan
Yes.
karon sa atong Soto Live, debunking myths on HIV/AIDS. No, kay ngano Shera? Kay Didi sa Soto, kalidad ng serbisyo, among garbo. Kini si Dr. Helen Madamba.
Og sa ngalan ni Attorney Ray Chris Manugaling kini si Chara Villanueva.
Mao kini ang Soto Live. Maayong gabi.
May